sort of talking in the present. So from 2003, when you started fellowship, to 2023, when you're training fellows, you've seen some progress, but there's much to do. There's still a sort of a male work your tail off culture.
Yeah. Yeah, there is, but you know what needs to happen for that is and actually organizations like the American College of Cardiology, particularly Women in Cardiology, the
Mhm.
section within that, they are really trying to change this culture, and it really needs to come from women as well. Of course, you know, there is this whole thing of how this field has always been like an old boys club, um, but we really have to take a step back as women and say, do I want to be part of that old boys club? I mean, do I want to play like them in order to be accepted there? And that is the question I think we need to ask ourselves. And what about the other ways in which we contribute to this field and the many creative ways in which medicine can be practiced, particularly in this time, in this age of digital medicine and technology and artificial intelligence? There's a lot that can be done without, you know, this inefficient. If you're working 100 hours a week, I don't know if that speaks of efficiency as much, right? Working hard is not working smart, in my opinion.
Yeah. And I would agree, as a outsider watching Twitter at the national meetings like we just had, American College of Cardiology, you guys own the vibe. People may not have caught you. There is a hashtag WIC, Women in
Yes.
Cardiology. There's groups. And, you guys got a better vibe than there's no MIC, Men in Cardiology. That's tradition. And
Yes.
maybe that's going to a meeting and slapping each other in the back. But you guys got Martha Gulati and Aaron Michos and all kinds of activities going on. And I usually think when I watch that, because I have not been to a national meeting in a little while, that's the group I want to go hang with. They're
Yeah,
hanging together.
it's
They've created
incredible.
there's a community, and there's
Yes.
support, and
And while there is all that, you know, that while there is this national kind of recognition within our societies that there is such a thing and a need for such a thing, remember that you know, most cardiology practices, you know, it takes a while for this knowledge and for this view to percolate into um, down to the trenches, so to speak.
yeah, we're still talking about gender here. Do you think there's pay disparities? You're an academic physician, and hopefully that's not the case. Private practice. Do you hear that from any of the fellows? Do you sense that a male fellow coming out of your program might get a more lucrative offer than a female fellow?
Well, I think the gender pay gap is definitely a thing. It's recognized, and it's very much prevalent within cardiology as well. And part of the issue is that we don't talk about pays.
No.
Right? We don't talk about salaries. I'm not going to ask a colleague, what do you make? Or nobody's going to ask me, what do you make? And, you know, that is definitely the case. And that is something, again, that how do you account for productivity and for contribution that may not be RVU based? It may not be that you're seeing 100 patients a day, but maybe you are contributing in other ways that are very, very meaningful and have an impact on patient care on other levels. And such things are not really standardized. There is no weight for it. And so we are still stuck in this model of what we have been discussing, which is you need to work 100 hours a week, and that is the only way you know, you are going to be able to meet those standards. And again, that's a big problem for women.
Being not quite a full generation older than you, but nearly. I can remember so clearly that we all used to talk about Willis Hurst, who was chief of cardiology at Emory, wrote the textbook, Hurst textbook of cardiology. Now, 4 a.m., Emory was a 4 a.m. start time. He was in his office at 4 a.m. writing chapters of the book. And it's interesting, just on that one topic, how much emphasis we put on sleep now for cardiology wellness and atherosclerosis and rhythm, prevention and the whole thing. They're inconsistent. We have to change the model and break the 100-hour work week as being mandatory.
Oh, yes. Yeah, and also, this whole awareness around physician burnout is a big deal, right? Because now we're seeing that what is the statistic? 1 in 5 or 1 in 8 physicians are leaving medicine.
Yeah.
Because they just don't want to do this anymore. And then what are we going to be left with? It's so hard to get into med school, and physicians are leaving. So who's going to take care of this population?